Well, good afternoon, or is it good morning if you're over in the States, or are you over in Australia and it's good evening to you guys? And I suppose the International Congress on Obesity over there in Melbourne. Thank you so much for coming and joining us today on our patient lounge. I can't explain how exciting it is today for our team. We have launched a podcast series focusing on the voices of young people in obesity, teenagers, young adults, what their challenges are, what the barriers are. We know that 1 in 7 15-year-olds are affected by overweight and obesity. And what can we do to give them a voice? How can we help them? How can we support them? So naturally on that, you want to know what is coming up in today's show. Well, let me tell you that we are blessed that we have the wonderful Melanie Balk from Germany, who is a parent of one of the young teens who has been involved. We have the Big O project being brought to you live on our show with Abby Traylor-Smith from the UK. And we have, of course, a professional perspective from Professor Jason Halford from the UK, who's over Melbourne at the moment and will dial into us. Now, what would it be without our patient lounge panelists, our advocates? And of course, we have Abby will join us on the guest panel, but we have Constantine from Bulgaria, who not only is a young advocate, but has also moderated the actual podcast that you can download. We have Mario from Portugal, who is a president of APCOI, and of course, our secretary from ECPO, but also the executive director from ICPO, Susie Burney. So if you want to get in touch with us while we are live for the next hour, you can indeed. You can go onto our social medias. You literally just use hashtag ECPO Patient Lounge. Our comms team will pick up your thoughts, your comments, reflections, and they will share them with us, and we can talk about it while we are on live. And of course, we are recording this. You will be able to watch back later. It will be on all of our social media. It will be on our website, but it wouldn't be our show without the support from our sponsors, from Novo Nordisk, from EASO, and from WW. Now, let's get to it. Let's delve into an interview I did with Melanie, who I've had the honor of working with many of my colleagues over the years, and especially with Melanie. And she not only shares her insights from one mum to another mum of a young person with obesity, but she shares about her daughter who was a part of the podcast series. So Melanie is not only a mum and has lived with obesity, but she is also chairwoman of ACS Dev in Germany. Now let's have a listen to what Melanie had to share when I caught up with her. Well, good afternoon, Melanie. It is an absolute joy and a pleasure to have you here from one mum to another mum. Welcome to the Patient Lounge.
Thank you, Vicky. That is amazing that we both moms can speak about this, and I think it's time to speak.
It is. I completely agree. In the pre-chat up to this, actually, I was telling you that listening to the podcast, I found extremely challenging. I got very emotional because I recognized a lot of my own personal childhood experiences in the teenagers as they spoke. And then I reflected on my own children and their experiences. And as a mum with a young adult who has her own experiences, can I ask you, first of all, how do you feel about your daughter being a part of this podcast, but also how do you feel about, what she may be experiencing?
I'm very proud of my daughter, but I'm very proud of my daughter all the time. And she's my warrior, and not they do the podcast. The podcast is the cherry on top. I think to be a mom with obesity and have a child with obesity, that you have two seats. You have you try to have a good care, and sometimes that's completely different. You see your own experience and you know so many things, and you try to do it better, but the system can't help you. And then you know, oh, you mean that's your fault. You made something wrong. And when I grew up, I said to myself, Mom, to my mom, Mom, you're not doing something wrong. You do that what you have to do on this time. And but for myself, I said, okay, I do it better when I have a child.
Yeah. Yeah.
Yes, and when I have a child, I was helpless. I was so helpless. I think Maite was 2 days old, and we left the hospital and we go to the childhood dog, and Maite was 5 pounds, and he said, "Oh, you must look about your weight." And I said, "Oh my gosh, 2 days old, a baby, 5 pounds. Maybe she's too big." And then starts in my head to make diet. And I said, "Stop, stop, stop. Please listen what you have learned. That is not the right way. That's the wrong way. But you not know when you are a young mom, you not know many things
No.
about food and portion size and all these things.
Yeah.
And nobody tells you.
No. I think that is part of the problem that we have is that, as moms, and I know myself, I blame myself, and I have done in the past for my own obesity, and then I blame myself for, my child has obesity, but they're eating, ice cream, and how people judge that. But we're not bad moms. We weren't given the tools to actually manage obesity with a young adult, with a teenager who wants to be just accepted like all of their friends that don't have obesity.
Yes,
But this is a big problem because we have so many moms out there who do blame themselves and call themselves
yes.
bad moms. And what can we say to them? What would you say to them?
We are not bad moms, but we must have good care, and not only a good care of our kids, of their friends.
Yes.
I know one day on the school, I pick up Maite and some girls judged her. And I say, okay, now that's the point. I can never say nothing. And I said, sorry, can we speak about my daughter? And they are scared. They're very scared. A big woman comes and like to speak. That that makes very scary. But yes, they said okay, and I said yes. We are living with a disease, and have not a choice to say no, thank you.
Yeah.
We must live with them, and it's not easy. And we speak 20 minutes, and then the girl says, "Oh, I not know that, and never like to do this." And we go, and 1 year later, might have birthday, and the girl stand in my garden. And I said, "Oh my gosh, that's a problem." And no, that's not a problem. They see what we cook for food, and she said, "In my house, for my mom, only um, we become convenience food. They never have a salad, and they never have mushrooms or something fresh in the yard." And there was, wow, you do nothing wrong. You're a great mom. Can I live in your house? I said, okay, that's too much. But yes, for this time, I start to explain my and Maite's disease in the kindergarten and in the school. But that is, you must have very strong. You not have to cry or destroy yourself. You must be quiet, soft, and many empathy.
Yes.
And I have many time I look for a program for Maite for lose weight, and I not find something in Germany. That is, sometimes you have a little spot with a little piece of child, and you must drive 2 hours, and that's not possible to go there. And I find a program that goes from city to city. That's name Be Self, Be Safe, Be Strong, and that helps Maite so much to say, hey, I'm Maite, and I'm good, I'm okay, and that is the best thing what I have can give her.
Yes,
The
indeed.
self love and the strange, the straight to say yes, and that is the thing. Sometimes we must change our minds to be open and
Yes.
look what my child need, not what the neighbors need or my mom or something.
This is so what you spoke about there. This is one of the biggest challenges that we have, the assumptions that people make. They assume that we eat unhealthy foods. They assume that a teenager with obesity is eating convenience food and fast food all of the time. And then when they actually see that, majority of the time people with obesity are the ones that are trying healthy food and going to the gym and have tried all the weight loss programs. And then people without obesity, like I look at my brother now, he won't mind me saying this, my brother, he can eat 2 McDonald's meals and not gain any weight. I just have to smell a chocolate milkshake and I gain 1 pound.
Oh
That
yes.
is so fair. But this is part of the problem we have. And when I was listening to the podcast, actually, and when your daughter was speaking with the other teens, one of them actually said, I think it was Reese from England, he said, I'd love to know if it is the same across Europe. Is the treatment the same? Because how he has been treated by healthcare professionals in England has not been great. What he's received has not been great. And I listened to various other stories. And then I listened to what you're saying about your daughter in Germany. And it would appear that we have a huge problem across Europe where young people with obesity are not receiving the correct medical treatment, intervention, management. What do you think needs to be done, Melanie?
Um, for this Maite do something right. The childhood dog said you must go on a place to lose weight. And 2 weeks after, the doctor calls me and said, "Can you speak with Maite? She must stay longer." She said, "I said why? Oh, she not lose so much weight." And I said, "Do you have speak with Maite?" He said, "What do you mean?" I said, "What means Maite? Not speak with me. I'm the mom, but it is her life." And I said, "Yes, okay." And we drive 500 kilometers to visit Maite. And we speak with the doctor and Maite, and the Maite says, "Sir, sorry, but I learned from my mom that is not the right program for me." And my mom not say that to me. I see what she doing all the time, all the days, and to be on a safe place and have 12 hour sports and have diet food, that's good for here. But I live at home, and in my house I must go 12 hours to school. I must handle my own life, and what you learn to me is not something I can do in my real life.
Yes.
And the doctor says, "Wow, you are 13, and no, no other kids say this to me, but okay, you are right, and you can go home." And for this, I said, "Okay, I know Maite knows what is good for her, and I not can say you must make this, you make that, but I'm always around her. I can catch her up when she fell down. I can give her hugs, and I think we must wait for some solutions,
Yes.
and that's hard.
It is hard. It really is. And as you're speaking there, like I'm picturing your daughter having a conversation with a healthcare provider and telling him that the treatment he's proposing is not suitable. So therefore, we need personalized treatments. We need personalized treatments for young adults, and
Yes,
this is something that we have not had. But I think your daughter has benefited from the work that you do in your organization in Germany, where she understands obesity can be genetic and it can be psychological, it could be neurological,
yes,
socioeconomical, environmental, and so on and so forth. So she understands this. And I think before I let you go, because you are an incredibly busy lady, but just to ask you as a parent speaking to other parents where their teenagers or young adults have obesity, what would be your advice to them?
love her child. Every what they do, love your child. Give him strange that when they have a problem, they can come to you. They not come to us, I know, but the option, we are here for you. And when you have a problem, we can look together. We have good care, and maybe go to some informational days or support groups. And why you not go with your daughter together on a support group? And yes, the most are adults, but the kids understand more than that we know.
They do indeed. And I think what you've said there is key, really. Um, Getting the right information, the right education about obesity, joining a support group. If you can bring your young adult or teenager with you to that support group so they realize they are not alone. And that is something that you'd said, your own daughter said when she did the podcast. She was like, oh my goodness, there are other teenagers who have the same challenges as me. And there's something incredibly empowering about that to know that you're not on your own because obesity is a very lonely, isolating disease.
Yes, and something what I like to do with my daughter, I like she smile. I we go out and we have experience. It is hard. It is hard for me, and it's hard for her. But when other people says yes, you're so nice, or you're very sweet, that gives her so much, and she smile, and that what our kids needs, empathy.
Yeah. So we need a world with more empathy, personalized treatment, but most importantly, no judging and shaming and bullying of young people. They need love.
Yes,
Melanie,
thank you.
thank you so much for
I
your
thank
time,
you.
your words, and we will speak to you very, very soon.
Yes. Bye.
Well, you are very welcome back. And what a powerful and thought provoking interview for Melanie as a mum of a young lady with obesity. And as you heard, a very educated young lady. Now, I am delighted that I am joined by a beautiful panel. Now, we have the wonderful Constantine, who moderated our podcast from Bulgaria, who is 26 years old. Studied law, is an absolute superhero in real life. And speaking of superheroes, in Portugal, we also have our Super Mario. So Mario is joining us from Portugal, and many people will know Mario from the lounge. However, we have a new guest to our panel, and I'm delighted that we can bring award-winning Addie Traylor-Smith to finally, for the first time, to our live event. Now, thank you all for joining. We've got about 6 minutes to delve into this before we actually go further. Constantine, you moderated the podcast, and now you've just heard from one of the mums. Can you give us a couple of minutes on your thoughts after listening to Melanie's interview?
I'll be very quick because I wrote them down just to make sure. But first thing I want to say is, Melanie, I'm very proud of your daughter. She was absolutely amazing. She's very aware, she's very well spoken, and she definitely knows what she needs and what she wants. One key point that I'd like to discuss is Melanie said that when she was young, she thought that she would do better than her mother, but she didn't succeed in that goal. And what's concerning to me is that what she said, it's as a young mom, she didn't know many things about food, about portion size. This is an extremely big issue and a key point from the whole interview, in my opinion. We need the proper tools and the proper information to deal with this issue. We need to educate young parents on what they should feed to their child, on how they should do it, or if their children are predisposed to obesity, there should be a different method to the whole thing. Just a very, very good point from Melanie that she touched on, and I'm very thankful that she did. And we need to work a lot more in that field. Young parents need to be educated on food and be prepared for what's to come. Also, another thing that I would like to touch on is when Melanie said that she had to explain that her daughter is living with a disease to another girl, I believe. And from an outside point of view, informed on this, if you're informed in this field, you would see why this is very problematic. Because with bullying and with the lack of acceptance in the environment, having to explain that your child has a disease is awful. Like, imagine your child had cancer and she was getting bullied for it. That doesn't happen because everyone is aware of the disease of cancer, but people are not aware of obesity, and we need to work on that. So those are the two things I would like to, the main things that I took from her interview, and she was amazing, and her daughter is amazing as well. And I cannot wait to speak to her again.
Thank you so much, Constantine. I think you put it very articulately when you actually spoke about the challenge that we all face, not just young people, but as people living with obesity, explaining that it is not just lifestyle, that it is an actual NCD. So just moving on from that, Mario, you see this quite a lot, right? You work with young people in Portugal. You've reached 500,000 schools, or sorry, 500,000 young people in schools in Portugal. What's your thoughts?
Well, Vicky, I've heard Constantine words right now and Melanie's words, and we are always talking about lifestyle, food, prevention, and that is very important for all the NCDs, not only obesity, but that is prevention, that is not treatment. And I think part of the stigma that is with obesity is because even healthcare professionals were not aware of obesity as a disease a few years ago, because science is always evolving, always changing. And what I feel is that people need to understand that some of the causes that are linking young people to this kind of situations is emotion. So we heard Melanie talking about love your kids. And it's all about love and emotions. People need to have conscience that no matter what is your condition, if you have a disease, you need to be loved and by everyone. So, and about schools, for example, I feel that if there is any student in a class that has, for example, has Constantine said, some kind of cancer or another disease like diabetes, and is diagnosed and it is in treatment, the teacher needs to be aware of. And for example, a simple situation like a birthday party in the school, if there is some restriction, other parents have that conscience, but nobody cares about children living with obesity. So they expect simply that for example, this child will not eat candies because he needs to control himself. This is so unfair. It has to end. And I'm so proud of these young groups that recorded this podcast. You know that I know one of the participants from Portugal, and I was completely and absolutely surprised to listen the way this teenager talked about this disease. She doesn't guilt anyone. She doesn't guilt her parents, nobody. And she experienced so much situations of bullying in school, and she's still concerned of the others' judgment. So it is so important to listen to what people have to say. And for healthcare providers, for example, what I think is, if you go to a psychotherapy, this healthcare provider will listen to you, but other healthcare providers have absolutely lack of time, and they don't listen to their patients, especially when they are younger. So they talk to the mother, as Melanie said, and everything like that, but they don't listen. What are the needs? What are the concerns? What is worrying young people? That is why it's amazing to see these podcasts, to heard what youth have to say about obesity without taboos, and it's empowering also for us. I think for me it was very empowering.
Thank you so much, Mario. I completely agree with you. And when you spoke about the emotion, we don't think an awful lot about, what they go through and what it feels like. I know what it was like back in the 80s to go through it and be somebody who had weight and was bullied and shamed, called names, and I almost just accepted it. And when we were going into this podcast, one of the things that I thought was, I wonder, is it different now? But it is the same in so many ways, except for the bullying is worse. They have social media now to contend with, and they have that platform that we never had. And on that note, I want to come to yourself, Abby, and I want to, for the next few moments, just maybe next 5-6 minutes, we have a conversation about, you have started this tremendous project, the Big O Project. You have spent a decade now following young people in the UK. And first of all, I'd like to ask you, what was the objective? I know for us, we've seen some of the research from the Action Teen study where we went, we need to do something about this. But for you, where did that come from, and what was your thoughts and your objective on it?
Well, sorry, I'm slightly in tears at what Melanie was saying, talking about self-love, because I think that's a really key thing. But for me, growing up fat, I mean, I wasn't bullied like so many of the kids I've spent time with, but this society, I felt like I wasn't good enough, and my parents carted me off to Slimming Club, and everything revolved around being fat. I know that's not a language you like to use, but for me, that's what it felt like. So that, for me, that clouded everything. Being fat meant I didn't feel good enough, and that's something that's kind of stayed with me my whole life. So as a photographer and an artist, about 10 years ago, I decided to turn my lens on the subject that actually means the most to me, obesity. And there's nothing out there, image-wise, showing people living with obesity, in an empathetic way. So I decided that would be my mission in life, to document, the people behind those statistics. That is just mad. 124 million school kids living with obesity worldwide. It's probably more than that now. Because I think the shame and for me, I was interested in those psychological effects, and trying to explode those, the feeling, it's like you've all said, it's deemed to be a self-inflicted lifestyle choice, and people who are living with obesity are labelled, and I think it's the last remaining taboo. And that's why the project's called the Big O, because obesity has become the thing to fear. It used to be cancer was the thing to fear, the big C, and hence the Big O. So that's where it all started.
Can I ask you, when you were listening to Melanie, to be honest, I was in awe when I went onto your website, first of all, when Susie told me. And I looked and I thought to myself, this has to be a mum of a child who has obesity, because you were so passionate. And then I realized that you had your own personal experiences, like you just explained here. And that made that connection. But when you were listening to Melanie, you said that you were almost in tears. And I wonder, when you're working with these young people, does that happen? Because when I was listening to the podcast, I had to stop, wipe the tears, step away. I'm listening to lines of, a young girl in Germany saying, people who don't know me, they assume that I'm stupid, they underestimate me, and I get bullied. And I'm like, that gets me in the feels. How do you manage that? Because you're so close to them as a photographer.
Do you mean that how do I manage the kids and the judgment and the shame around them?
The emotion.
Yeah. I mean, the emotional, I'm a really emotional person. That's what all my work's about. It's about trying to draw that empathy, get people to understand through imagery that we're all humans, So the emotion is, for me, if someone is emotional, I'm like, yeah, I get you, I hear you, I totally understand. Yeah. And that's why they say yes to taking part in my project. And that's partly why it's taken so long, because 10, 12 years ago, it was even worse than it is now, in terms of, the worst thing to be in the world is fat, Yeah. So all the kids that have said yes are those who are sick of being shamed, judged, misunderstood, etc. So that's the motivation. That emotionality is their motivation for putting themselves out there and, being part of my work. So I just, when they, when that emotion comes out, then we talk about it, we use that, and we channel that back into the work.
Can I ask you, going forward with your project, where is it going to go? Where do you hope for it to go? What is your dream with it?
Just to get it out there as much as possible. I'm about to publish a book, which is the first chapter, which is on one girl, Shannon, who was the first girl I photographed. So the book is about her life, and I sort of feel that by showing one story, we might all relate to that. I mean, we've all been teenagers, whether you've lived with obesity or been fat or not. Everyone can relate to that kind of awkward teenage feeling, whatever it is, whether it's acne or being ginger or whatever think of all the million things that we've all felt awkward over being a teenager. So I'm hoping to sort of tap into that. And my dream would be to see this work really, for it to be seen by as many people as possible. I mean, I was in the gym last week, and one of the women said to me, she's not, an artist or a photographer or anything, she works in a shop, and she said, wow, I saw your work, I can't believe how it affected me just looking at the pictures. So she's not someone who has lived with obesity, and she could see what those kids are going through the imagery, and for me that was kind of like, yes, that's where we're at, using imagery to get people to rethink. It's about opening the conversation, it's about getting people to question their prejudices, basically. It's about challenging. It's kind of, let's throw this conversation open, that's my dream, really. And the big dream would be to sort of do a global project and photograph kids from all around the world, because I think that would really, I mean, I would imagine there's slightly different things going on in different countries, but from 20 years of traveling the world photographing people, there are things that link us all, you know. So yes.
Absolutely, yeah. And I think we can bring Susie in now, actually. Constantine will see you in a few moments, but we can bring Susie in now because you've actually worked with Susie as well, Abby. And one thing I want to understand is that we've created an image bank of young people to promote that positive imagery, the real imagery, not that they're constantly bursting out of clothes and eating hamburgers, that, they're just real people living their best lives that they can live. And Susie, part of that, you actually became a model for Abby when you did a different campaign. Can I ask you how it felt? Because I know how emotional Abby gets about it, but it was emotional for you, I'd imagine, as well, right?
I think anybody who knows me, Vicky, would know that the word model and standing in front of a camera is probably the furthest from what I would ever do or feel or think.
I was
But
just
what Abby
about to
did
say,
for me,
I
yeah,
was just about to say
what
it's not a model because it's a case study,
yeah,
you know. It's yeah.
yeah. What Abby did for me was like when she said, "You're not a statistic." It's bringing the faces, bringing the real people, and we quote all the time that 60% of people living in Ireland live with overweight or obesity, and I'm in that statistic. But Abby brings out Susie as a person, and I was totally out of my comfort zone. But I spent 2 full days with Abby for this project, and I've never met anybody who gets it for in their profession what they're doing. And the experience I had with it, I'm actually getting a bit emotional. It's she made me feel more than a statistic.
I think some of the images that Abby took of you, Susie, because having worked with you, we all know your passion for swimming and, the outdoors, and, you have an excitement in you when it comes to that. And Abby captured that so beautifully. And I wish that, when Abby speaks about her dream and her goal, that maybe as ECPO and some of her colleagues around the world, we could actually work to make that happen, because that is what we need. We need more of that real person, the actual person, not just, as you say, a model, but the person. But Mario, can I get your thoughts on the project? Because you've got some tremendous projects going on, buddy, over in Portugal. Come on now, you've got an app going on, you're hitting schools with this beautiful book. Can I get your thoughts on what Abby just said for the next 2 minutes before we go to our next interview?
I just get to know this project through this campaign, and I'm amazed about your work because that is really what is needed to give real images about obesity so we can engage with more people, and not only healthcare professionals, not only the scientists, but all the audience, because everyone needs to understand that these images that keep going to media all the time are not real. Come on, this is no. It must end. So we really need to feed all the media with real people, so that even when a journalist, and you know that I come from this area, so media and communication and journalism. So when a journalist is writing an article, if he's really seeing image bank of people that are in real life doing normal things, and not that images without showing the face, without only focusing on a balance or a scale, or it doesn't he doesn't connect with what he's writing. So it's not touch about the disease. So he will just even write with stigmatizing language and images like what you create. And congratulations on your work. You are a very good artist and photographer, of course. And these kind of images, and all the images that we already have in our image bank, and I really hope that we have more, these can make real difference, because with the journalists, with the audience that will see all these images and in a book that you are launching. So we have to spread this out and to share images and stories, not only statistics. And statistics are very important. And we also use statistics on this campaign from ECPO that we are launching today. But behind all these numbers, behind all of that, there are people, and we are people's first language, imagery. So we have
Yeah.
to work on this.
We do. Thank you, Mario. And as Mario said, it is about the person, and that's what you've very beautifully captured. You've captured real people with a disease living their best lives, and we're very grateful. And we will support you in any way, shape, or form, and share all of your content. And thank you for just being tremendous and doing what you're doing, Abby. And unfortunately, we have to move to our next interview, but I will catch a few of you later for the panel. But in the meantime, we are going to move along, and I had the opportunity to catch Jason Halford, Professor Jason Halford, who is head of School of Psychology in Leeds University. He is also president of EASO, for those who don't know. And I got him for about 7.5 minutes, 7 o'clock in the morning, because he's over in Melbourne, Australia. And I had a chat with him about the campaign and his thoughts, his professional opinion. So let's have a listen to what Jason had to tell us. Well, good evening, Professor Jason Halford. It's an absolute pleasure to have you all the way from ECPO in Australia. How are you doing? Thank you for joining us, by the way.
I'm really pleased to be able to join you and take part in this evening's event. This is a really important topic and is very much the focus of the meeting here in Australia.
It is tremendous to hear that, because as you know, and we've had a good conversation about this. You and I have worked together on Action Teens, and you're lead author there. And as you know, we've spoken to Melanie, we've heard conversation and thoughts and feedback from Abby. We've spoke with the team, our panel, and I think the emphasis here is some of the, I suppose, the harrowing lines and words that came back from our young adults in the podcast. Now, I've spoken with you about some of them, and we've listened, and really I wanted to get your professional opinion, what you heard, what we've spoken about, and then let's talk about how that aligns with Action Teens, and does it align?
I think Action Teens tells us things on a certain level, but I think personal testimony tells us a lot more. I mean, first of all, the story about trying to stop eating, physically restraining yourself from any eating at all, to try and fit in a dress, and that's not a superficial thing at all. It's a very a goal that we can all understand, and a very extreme behavioural response to attain that goal. And I think that speaking around the development of an eating disorder or disordered eating, which we know from working with people living with obesity is a problem for a good number of them, but we can see really the genesis of it here. And I think there's lots of stuff around mental health that is really coming through very, very strongly. And we know that adolescents per se have issues with mental health, but we can really see the problems with mental health being writ large in adolescents living with obesity.
Indeed. I think there was some quite harrowing conversations that were had on the podcast with Constantine, and I listened to Marta speaking about becoming a marine biologist. When they were conversing, I listened to Mara talking about being sat in the back of the class or not being involved in group lessons, and having the teacher to come over and ask her to join a group because nobody would sit with her. And this really ties into how people underestimate or judge people who have obesity, and particularly teens. And just when I think of your career and the work that you do, how does that affect a teenager in their development going into an adult?
isolation is a big thing, and that piece around bullying and being separate and being sat at the back of the class and feeling that isolation, but also not being able to express what you can actually give. I think that has really negative consequences. And I think we think about the isolation, the impact on self-esteem, really big links between low self-esteem and mental illness. And it strikes a chord in a lot of the literature that we read, including action teens. We know in the action teens that low self-esteem and mental health issues were associated with increased age in the adolescents, particularly being female, not saying it doesn't occur in males, and the high obesity classifications as well. And we think particularly for those individuals who, although many of the adolescents will be living with overweight and obesity, for those who are living with a very higher classifications of it, this will have a significant impact. And if it cannot be challenged in a therapeutic session, will go on to have lifelong impact, because we know that suffering obesity in adolescence has greater impact than having obesity or suffering from obesity, the starting point in adulthood. And I think that's the point. And so there is a point of intervention, and that point of intervention is critical, because if we don't, it will lead to greater BMI classification in adulthood. It will lead to greater feelings of hopelessness and helplessness, more weight loss attempts, but more failures to keep the weight off, if you see what I mean. So there is a kind of manifesto for early intervention.
Yeah, apologies to the noise in the background. That is my doggy kind of growling to go out for a run around. Apologies, but just actually on that, right, because I know we only have you for a few moments, but one of our young adults in their interview actually said, why can't my doctor see me as a patient and not just a weight? And when I think about that line, I think about what can we do? Like, what on earth, if a 14-year-old is thinking that way, what can we do? And for yourself, a president of EASO, what is the way forward?
I think training is the way forward. I have to say, healthcare practitioners get very little to no training on obesity. They do get some training now around therapeutic discussions, but not enough. But they certainly won't have training around talking with adolescents about any healthcare issues. They really don't get that. So when you add on the lack of knowledge and training for obesity and the lack of knowledge and training for adolescents per se, you're really hitting an area which is doubly underserved in healthcare practitioner training. And as we as adults who have adolescents, are caregivers for adolescents, we know how difficult those conversations are with our own adolescents in our households. So we can kind of understand where healthcare practitioners might. I don't want to blame healthcare practitioners, but they really need support in the developments about how to have those conversations, how to ask permission to have those conversations as well. And I think that's very, very important, because I think adolescents close down, and to get them to open up is very, very difficult. And whether they are being talked at about obesity, they're being defined by their obesity, or whether that's just a side effect, it doesn't really matter, because that's their lived experience, and we have to accept their lived experience, because if we don't, we won't be able to have a conversation with them, because there is miscommunication. So there has to be that understanding of where they are.
Exactly. Yeah, I think part of the challenge we have as well is that many of, as you say, about GPs and HCPs or healthcare professionals, they don't have the training. Many get 0 hours of training, but as well as that, there is a misalignment and within disease recognition. There isn't an understanding of the science and the research. So I think, the work that you do, the work that EASO does, is absolutely tremendous. It's a pleasure for us to actually have your experience. And I'm going to let you go back to busy sessions in Australia. I know you're lined up for many interviews and everything else. So Jason, thank you so much. But if there's anything else that you want to add, please just add it in now, and we'll give you the final word on our patient lounge.
What we need to do is really consider the adolescent as a person, as an individual, and I think when we talk to people rather than their diseases, I think we will always do better therapeutically.
Indeed, we will. And it was a perfect way to end our show. Thank you so much, Professor Jason Halford. Have a wonderful time in Australia, and we will see you back in Europe very soon, I hope.
Thank you very much, Vicky.
Well, thank you so much to Professor Jason Halford, all the way from Melbourne, Australia. But I would like to welcome back, because we've got about 8 or 9 minutes left, I'd like to welcome back some of our panel. Now we'll have Constantine join us, Mario and Susie. And actually, Constantine, I will come to you first, right? And I'm conscious of time, so if we can keep our answers to about 1.5 minutes, 2 minutes each, that would be great. But you've actually worked a lot with Jason. When I did Action Teams with Jason, he was lead author. I'm delighted that we have the plain language summary out today that I got to lead as well. But you actually got involved and you've been working with him. Was there anything that he said there that resonated when you think about the podcast, you think about Action Teams, what we need to do? What's your reflections, your thoughts?
Thank you, Vicky. And yes, I've had the pleasure to work with Jason and to do an independent commentary of the Action Team study. I was familiar with it before it went public. And honestly, I'm very thankful to everyone involved in that study, because even in the podcast, I am going to be asking many questions that are related to that study. And that study is setting, honestly, an example for good questions to ask those young adults, because as Jason said, the healthcare professionals and the parents need education, but in some cases the kids need to, because we have on this podcast some adolescents who are very self-aware, very well informed, very well spoken, and they know what they need, what they want. But in most cases, I believe that's not entirely true. So we need to work with the young ones as well. That's a key point I'd like to make.
No, I would agree with you. And I think one of the lines that came from, I think it was Reese from the UK, he said he'd like to know what it is like across Europe, what the treatment is like across Europe, because that's his main thing, how he's been treated. And I got the impression he didn't mean he'd been treated in a positive way, that he wants to know, what's it like across Europe. But I think something that Jason said there, and I'm going to come to you now, Susie, actually. Jason said towards the end there about treating the person. And I think we really captured that when we were speaking with Abby, right? It's all about treating the person, identifying with the person. And can I get your thoughts after listening to today's event, and what's your reflections?
Yeah, definitely. I think we've heard that a couple of times, that it's seeing the person, and that's as Mario said, we're people first, and we've explained that. But something that is standing out to me is about how we have this conversation and how we bring it up. And I think people living with obesity, is certainly in my age group, we have hidden it for years because we try to protect family, and our family are worried about us, and we're worried about them, worried about us. But if we don't keep talking about it, then how can healthcare providers understand what they're treating? How can they understand us as people if we don't share what we're going through? So to see the young people talking about it now is absolutely amazing, because I remember at 16 hiding everything from my mother about what I was living with. So I just think this is absolutely fantastic for these conversations, because we cannot treat this chronic disease unless we as lived experiences share what we are going through on a daily basis.
Absolutely, Susie. And I think when it came to actually creating this podcast and trying to identify young people that would be brave and courageous enough, you had actually engaged with the young lady from Ireland. And can you actually give us that quote again about her doctor? What had happened with her engagement with her doctor, where he asked a question? What was it that was said? Because this really stuck with me.
She was brought by her grandmother in for a consultation. She was feeling unwell. It was like maybe a flu or something. And he said to her, "Oh, by the way, are you the biggest in your class?" And she said, No, this girl is taller than me. And he said, "I didn't ask you that. I asked, are you the biggest in your class?" And she remembers that. That was about 2 or 3 years ago. And yet she is the most insightful young woman. Like, I'm getting emotional because it's awful to think what she went through. But she came out with a quote for us. We were doing a magazine and we asked her, like, just her name was quoted. And she said, "Not everybody who eats fries is overweight. And not everybody who's overweight eats fries." And I thought, wow. And that was a youth having a voice that was just so insightful.
Yeah. It's powerful when they come out with things like that, and I think we heard that in the podcast. There was just these lines where, and I think that particular young girl, Cara, had actually said something around, why can't my doctor see me as a patient and not just my weight? And I'm like, if you're 14 years old and you're saying that, well, then we've got a challenge. But as Jason says, we can't shame our healthcare professionals, right? They're not getting, there's a misalignment. We as a society believe obesity is a lifestyle. In general, that's what the narrative is. The science isn't being aligned and the education isn't being given. So, Mario, I want to come to you for a moment and, what can we do? How can we help? Because we need to have these young voices heard, because this has to stop. It can't continue this way. If it hasn't changed, the bullying and shaming from the 80s, we got to do something, right?
Exactly. And I remember some words from Solveig, and she's always saying to support also myself, because we support each other, of course. And I remember these words that we need to keep educating. We need to keep educating also healthcare providers, because we cannot blame them for this situation. They are also learning. Everyone is learning. So we need to keep educating, showing the new science there is showing progressions, as it is on other diseases, as it is on cancer. There are new treatments, and in obesity there are treatments right now that can be used. So that's it. So we need to keep educating on schools, on universities, because there's a lack of education about obesity. So we have to keep it, push it in the media, because through media we educate also a wider, the wider society. So we have to keep showing stories like this. And I also felt when I heard the teenager from Portugal that I know personally. She said things on this podcast that she didn't said before to her mother or to her father about this disease. And this is so important that everyone gets to understand what is on our youth heads. So
Exactly.
keep talking.
What is times? Keep talking, keep the conversation going. And just on that note, Constantine, thank you so much for moderating it. You were articulate, you were empathetic, you were understanding, you brought your own experience. If people have not listened, guys, you need to get on Spotify, you need to get onto Apple Podcasts, get online, go to our website, www.ecpomedia.org. You will find all of the links there, all of the infographics, all of the information. And you know what? We're not just sprouting this as patients and saying, young people need support. We have the research of action teams. We have the Lund study, the co-create. We have all of this going on in the background. So everything has been, has that evidence base surrounding it. It needs support. Let's get their voice out there, share the podcast, and keep the conversation going today. It's campaign day. If you can use hashtag EuroYouth, and get their voice heard. It's not for me. It's not for Susie. It's not for Abby, Constantine. It's not for Mario. It is for the next generation. So thank you so much for joining us. Thank you to our production team. Thank you to our comms team. But it's time that we say adios amigos, ciao bella, slán, and we will catch you on the next episode. Thank you very much.